This is Health Unabashed on Healthcare Now Radio, a show that explores the world of health and wellness innovation, enabling sustainability, equity, and access to patient-centric care. I'm Greg Masters, executive producer and co-host, and am joined by my esteemed colleague, digital health advocate, author, and global thought leader, Gil Bashe. Together, we bring you thought-provoking people, groundbreaking ideas, and the transformative companies making a difference. Today, our guest is Tjasa Zajc, host of the popular podcast Faces of Digital Health. Tjasa is an internationally recognized digital health moderator and speaker focused on global healthcare digitization. She is a former healthcare journalist and a patient advocate. And with no further delay, Gil, the mic is yours.
Greg, I want to thank you so much for the gracious introduction. It's such a privilege. We're in the midst of our second season together, and I'm thrilled that we've been asked back, probably because of your amazing role as executive producer of this show and others, and your own show, Pop Health Week, with Fred Goldstein. Continue to do the great work, Greg. And everybody, we have probably one of the most amazing guests on today's program. Tjasa Zajc is, to me, one of the top people around the world, really around the world, when it comes to understanding the face or faces of digital health. She's also the popular host of the program, Faces of Digital Health. I had the privilege of actually joining her for a mini segment recently at Health, and we sat side by side in a Zen booth and really talked about what was happening at Health Without Vowels, and really explored what is the promise and potential and pitfalls of augmented intelligence, AI. We're going to explore that a little bit, but for anybody who has listened or seen Tjasa and the Faces of Digital Health, it is a much-watched show, and she has the most incredible guests. But aside from that, she could go on her own show as a solo. She's probably one of the most knowledgeable people around digital health applications in the world. And her knowledge is not just about the technology or the gee whiz bang of the ideas. She knows policy, she knows economics, she knows regional landscape. Tjasa, welcome to Health Unabashed. And I know you started out your career as a full-time journalist, and now you're working with Better and you're doing all these amazing things. But I wanted to go back in time before you were doing this podcast program. What led you to sort of jump into this with both feet? It strikes me as a very bold move, and you have really become worldwide popular. By the way, to our listeners, Tjasa and I shared sort of a stage in Tel Aviv, Israel, I think a little more than a year ago, with a whole conference that included France and Israel and other nations. She was one of the great moderators of a large panel of worldwide experts. I was mesmerized by her ability to really command that panel. I think there was like 7 or 8 people on your panel, and you really you were in charge. So again, welcome. Tell us a little bit about your journey for those people who don't know you and will know you soon.
Thank you, Gil, first of all, for all the kind words. I really feel privileged to be here. So I kind of decided to start kind of exploring healthcare from the professional side in my 20s, after my editor said that I should specialize for one area. So I was working for a weekly magazine here in Slovenia, and healthcare was one of the topics that nobody really covered. So I decided to do a master's in healthcare management and economics, because I was a chronic patient already for 6 years at that time. And I figured, I've got all these questions as a patient, and why not upgrade that experience with the knowledge of how healthcare management, healthcare economic works, and then have the opportunity to also talk to clinicians to get that perspective. So that was where my journey began. And then in 2015, I started noticing how basically healthcare or digital health and technology are becoming so embedded in medicine and healthcare delivery that we just should start caring more about that from the reporting perspective. Because in the magazine that I worked for then, it was a medical journal, a monthly journal for clinicians. We mostly focused on clinical guidelines in novelties, in therapies and things like that. And that's why I started the podcast, which was at that time called Medicine Today on Digital Health. And then when I left the magazine to transition to the startup world, I continued the show. I just renamed it Faces of Digital Health. And in total, it's soon going to be the 7th anniversary of the show. So it's been quite a long time.
That's incredible. Well, again, I was on the show. I've watched the show many times. Incredible guests always. Obviously, it's your reputation that attracts people to get on the other side of the microphone with you. And I have to say, you're one of the most interesting people when it comes to expansive knowledge, because of your knowledge of economics and policy and the technology itself. I wanted to get your take on this from a global standpoint. About 2 years ago, probably influenced by COVID, digital health was just exploding. Both the money pouring into it, people sort of mining new technologies that deal with disparities, adherence to care, remote patient care. It seemed like it was unstoppable. And then suddenly I see that investment has dropped as much as 40% in many cases into the field. And, I've seen the data and the granularity of the data. I don't think it's really just purely that the investment has dropped. I think from what I've seen, it's gone to earlier stage investments where investors have much more voice, more risk perhaps, but more voice in the venture itself. But I just wanted to get your top line. You're still a journalist now. You're an audio journalist. You're a writer. You're speaking to incredible people. What's your 30,000 meter or foot view of digital health right now in this climate, the post-COVID era?
I am actually quite worried or surprised by the significant drop that's happening. I think like what we saw was that there is a lot more interest into digitizing things, especially in Europe, because before COVID, it seemed as if the investment in healthcare IT wasn't taken as seriously as it was after COVID hit. So that's still present. So funding to actually get hospitals on a higher level in the healthcare digitalization sense is still there. But the challenges in terms of how fast you can actually introduce something have not been diminished. So it's very easy to do a pilot in a hospital, but it's very difficult to scale. So, for example, because the legislation is different from country to country, and even hospitals want different things. If you are a vendor, you will know that each client is going to have different desires around configurations. And when you multiply that issue with the issue of language and everything else in Europe, it's easy to understand why you are going to have multiple suppliers providing basically the same localized solutions on different markets, just because the whole scaling is so difficult. To go a bit broader, I'm quite concerned, as probably many other people around, what's going to happen with digital therapeutics, just because of all the excitement that we saw around it, maybe even 2 years ago, is kind of down because of the situation with peer therapeutics, because of other situations. Germany, before this discussion, we mentioned how Germany created this wonderful framework for startups to be very clear about what they need to do to become on the national formulary for prescribing and reimbursement of these solutions. But what that framework didn't solve is all the marketing and awareness challenge that startups need to overcome to actually convince the clinicians to prescribe these solutions. And the second thing that also happened in Germany is that in the initial stages, if you were approved as a DIGA, it was up to you to decide what the price will be, and healthcare insurances were willing to pay for that. But after a year, they would reevaluate your impact and adjust the price based on that. And because after a year, prices were slashed so much, some companies even went bankrupt. So now it's very interesting to observe how France, as the next country that's trying to create a framework, a very clear pathway, which I wrote about in quite detail for my newsletter. So France also designed a framework, and what they did differently is that in their pursuit of becoming a digital health leader in Europe, they're investing also in the upskilling of the workforce, in the awareness among the public around the meaning of digital health, and even before companies apply for the French DIGA, if I call it that way, there's already kind of classes of applications, so you can approximately know how much you're going to get reimbursed. And with that, France wants to avoid that shock that companies fell into after a year in Germany. So it depends on who you talk to, but we still have a lot to figure out around digital health applications and how to fund them. And that's just the thing, at the end of the day, digital health is very quickly expensive because the people that develop these are not a cheap workforce. So one of the things that I was kind of wondering is, the US has spent twice as much for healthcare as an average European country. So between 9 to 13% compared to 18 or 20% that the US spends. But I'm wondering, to which extent is potentially healthcare going to become more expensive also in Europe, not just because of the aging population, but if we want to introduce all these technologies, the funding is going to have to come from somewhere. So that's you can stop me at any point.
I think you've really touched on a key point that I don't think people think about, which is shifting populations. Historically, Europe was a younger population, post-World War II younger population than the United States. United States, like Japan, has become more of an aging population. But you've really hit on some things that I don't think we think about all that much, but we should. There are some companies in digital health that are acknowledging the fact that we tend to forget that digital therapeutics are being compared by physicians and payers alongside of therapeutics, molecular therapeutics. And so it's not enough to say the digital therapeutic is less expensive. I think the proof point is to say clinically it's equally effective, or more effective, or it's less effective, but it produces a good clinical outcome at a reduced cost. I think that a lot of digital health companies thought, all I need is regulatory-wise a 510K FDA approval, and I'm golden. And then all of a sudden, even if they got on formulary, let's say mental health or smoking cessation, doctors then said, well, where's the clinical evidence? And the bar to get a digital health therapeutic approved in terms of number of patients in a clinical trial historically was relatively low. I think that the companies coming into the field now in digital therapeutics have sort of a biopharma-like mindset. I think that they're looking at the magnitude of patients they'll need in a clinical trial, the design of the trial. I think they're pursuing this as a new path to therapy, much like medical device companies have to in terms of looking at the bar they need to jump over in order to say, this is a safe and effective therapy. And so I think the cost of getting in the game from a digital therapeutic standpoint has changed radically. I think you're spot on with that. I think it's a little more complex. Another thing I'd love to get your take on, because you look at Europe super closely, but you're traveling around the world. After all, the last time we got together was just a few months ago. I guess it was Las Vegas or LA, one of those great West Coast cities. I think it was Las Vegas. And the reality, I think, is happening also is investors are seeing digital health as somewhat risk-oriented. I think historically they said, gee, this is simple. Do a small clinical trial, get a 510K approval, get to the market, and wow. And now they're realizing getting to the market is half the battle. It's getting on formulary, so that someone's paying for it has become the major challenge. So I'd love your perspective. I think big investors see digital health as still enticing, but also not without risk. And I think that's why they're going to earlier stage companies, because I think that they can take the knowledge that they gained over the last 8 years or so and mold it into these younger companies. I mean, what's your take on that?
Yeah, so several thoughts come up when talking about that. So one is that it's very interesting to talk to all sides: investors, clinicians, startups, SMEs, and what it like startups need to create relationships in the long run, talk to investors continuously. Even if a specific investor doesn't invest in them today, maybe that investor is going to invest in them in 5 years or so. But oftentimes startups also feel that they are basically losing time because investors just need them to get that on the ground knowledge and insight and can decide better.
Go
And
to
they
market without thinking through the implications of that.
yeah, and just basically get the actual insights, because the startup founders usually start with point solutions and have a very in-depth knowledge about a very specific thing, and that's very useful for an investor. If that investor at one conference talks to 5 or 10 people like that, it's a huge gain, for an investor. But as far as being aware how much you can get out of investing in digital health goes, I really liked the latest newsletter from Chrissy Farr, Second Opinion, where she basically says that we should not expect as many unicorns in digital health as we do. It's just a different industry. So the appetites should maybe be a little bit different in this place. And I think that was also one of the kind of things that was mentioned in the case of Babylon Health. The investors were not necessarily in it for the right thing, for the better of the patients. And when startups are pushed to grow, that's where real challenges begin, if they have to start claiming things that are not necessarily true. And that's just a general thing to say.
Just tuning in, you're listening to Health Unabashed on Healthcare Now Radio. We are in the company of internationally recognized Tjasa Zajc, the host of the popular broadcast Faces of Digital Health. Tjasa is a former healthcare journalist and a patient advocate. Stay tuned for the rest of the story.
Were you surprised about Babylon, by the way?
I kind of was. And that's because I maybe followed that story a little bit more closely. I saw, the reports around the NHS and how basically Babylon started disrupting NHS with the offer of clinicians, because they didn't just have an app, they had actual clinicians as well, right, that people were using. I was very disappointed when they moved into the US market. And that's the thing, startups need to grow because of the investor pressure. So they move to a different market, and oftentimes that's the US. And what that means to me is that smaller markets, and I feel that very personally because I'm from a country with 2 million people with their own language, and nobody wants to come here because you can't operate in English here, and the market is simply too small. So that means that we don't have any digital therapeutics, and we can often get left out of these things. So that's something that I often think about when we think about the access of digital health and healthcare innovation globally, and the access in less populated places, in rural places, in less developed countries, where you just are not going to go to as a successful company because the buying power is not big enough, the market is too far away, and every market is specific. So you always need to be local if you want to succeed.
Last time we were together, it was probably one of the first times I've had a very practical talk. I think that, you or I, we're often asked to reach into the future, to be visionaries with the knowledge that we've sort of acquired over time. And we had a very practical conversation. We were talking about health and what are our big takeaways, and it was a fascinating exchange. I really, again, urge all of our listeners to follow Faces of Digital Health. It's just an incredible series of conversations. But one of the things I find about AI, particularly Gen AI, is the practical nature of the technology, the ability to look at health systems inefficiencies and problems and aspirations and begin to engage right now. For instance, in this country, electronic medical records are a bit of a mess, and the ability to scrape data off of the EMR and take a look at diagnostic patterns or billing codes, or taking a look at even therapies that were missed that would have helped the patient, or even taking a look at the patient's condition over a period of time and saying, did you consider this instead of that diagnosis? Gen AI has great application. And when I look at Babylon, one of the things that enticed me about Ali Parsa and Babylon was its early in use of chatbot. And I often wonder if people with health concerns right now feel more comfortable with chatbot and AI over speaking to a doctor, because it's not intimidating to speak to your laptop screen for 5 hours asking questions, but it is intimidating to go into the doctor's examination room, put on a gown that opens from the back, sit on some bench with your feet dangling over this, and somebody swoops into the examination room and has 8 minutes to spend with you. Chatbot doesn't really care if you spend 8 minutes or 8 hours. I think it's a success, not because it's better than a doctor. I think it equips the person with a health concern to be better prepared to speak to the doctor and utilize the 8 minutes. So I'd love to get your take on like the here and now of digital health technology, not so much what's going to happen in 2 years or next year. What do you think is going to happen next month?
So I would say, and just to quickly comment on what you also said, I think it's awesome what generative AI has done for medical note-taking. I think that's, especially in the US, pretty much clear that that's something that's going to be used everywhere soon to make note-taking easier. As far as patients go, first of all, you have to be cognizant as a patient that you actually prepare for a doctor's visit, and that's still not something that all the patients would be prepared for. But as far as using generative AI for diagnosis and solving your own problems goes, I think you just have to be, the question of how does that model actually work is still very present, and you have to. So I'm going to give you an example. I was using ChatGPT to do some research, and I asked ChatGPT how many insurance companies does Netherlands have, and it said 5 and gave me names. And I said, doesn't it have 20? And it said, oh right, yeah, you're right, it has 20, and it gave me 20 names. And I said, but no, wait, I think I made a mistake. And ChatGPT said, you're right, I made a mistake as well, it's actually just 5. So you really have to know that it can hallucinate, etc. I wouldn't trust it to prepare for my doctor's visit, and that's one of the really big questions that's currently happening in Europe, and I would say broader as well. Open versus closed AI. Should we have open algorithms and open models that we can test, that we can actually understand, that people can build on, versus having closed systems that you will have doubt over because you don't know how they're made?
You've just said something that I hope everybody sort of focuses in on from this conversation and your other work, which is, I think, the person who's in the know, who's cognitively sharp, ChatGPT augments their intelligence. It's an extension of their intelligence. If you don't know the subject matter you're exploring and you're using augmented intelligence as a tool, you can be horrifically misled. So I think that these technologies play to the strength of people who actually know the subject matter, as opposed to the people who are dabbling. You can really tell if someone doesn't know anything about it and they're exploring. It's not going to replace the doctor. It's hard for me to believe that in a 26-minute program, in a blink, we've gone through about 25 minutes. And I think I would need 2 hours to really explore everything that you know. First, I want to thank you so much for
only 2.
Yeah. I want to thank you, like, from the bottom of my heart. Again, I want to share with all our listeners, Tjasa Zajc is really one of the smartest people in the business, and her wealth of knowledge is composite wisdom. She's speaking to really brilliant people who come on our program, and she's just not speaking with them. She's absorbing their knowledge, and it's making you smarter and smarter. Just in the few moments we have left, you're speaking to people who are passionate about our subject matter. A takeaway on what can we expect in the coming year with digital health. Any few words you can share with us?
Oof, that's a tough one. What I can tell you what I'm going to be looking at. I'm going to be looking at how many digital therapeutics France implemented. I'm hoping that we're going to make some progress there. I hope we're not just going to say that digital health and mobile apps are a hype. That's what I'm hoping. And I'm hoping to see more introduction of AI also in Europe, because we still have a lot of questions around governance and legislation to answer. So I hope that the legislation is not going to hinder the development too much and all the companies are going to escape to other markets.
I cannot thank you enough. I'm looking forward to continuing this conversation again soon. Thank you.
Me too. Thank you, Gil.
And that, dear listeners, is the last note for today's melody. We want to thank our worldwide listeners for tuning in, and much gratitude to our special guest, internationally recognized Tjasa Zajc, the host of the popular podcast Faces of Digital Health. Keep up with Sasha's work via www.facesofdigitalhealth.com, and do follow her on Twitter via @ZajcSasha, and that's ZAJCTJASA. For more information about Health UnaBASHEd, head over to our program page at healthcarenowradio.com. Catch our show weekdays at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern, or 7:30 a.m., 3:30 p.m., and 11:30 p.m. Pacific. Keep the conversation going with Gil and me on Twitter by connecting with us via @Gil_Bashe, and that's BASHE, and Greg Masters, MPH, and that's Greg with 2 G's, and be sure to tag your tweets with #HealthUnaBASHEd. Until next time, embrace your passion for better health unapologetically.